I'm Dr. Joseph C. Gath Jr. I'm a practicing physician in the Third Ward community since 1986, and I'm also the chairman of the Health Advocacy Committee for the NAACP chapter here in Houston. The NAACP chapter is fighting for equality in medical care, and they're doing a lot of work on the state and national levels. But what our goal is on the Health Advocacy Committee is to equalize healthcare excellence on a local basis, to try to give the community the tools they need to navigate what amounts to an unequal healthcare system, unfortunately, here in Houston, the United States. And there are many tips that we can give you to help to be able to navigate to get equal healthcare excellence with the available things that we have in our community. And that's what our goal is in our Health Advocacy Committee and these meetings that we're going to try to have almost on a monthly basis. And I'm very happy with this first meeting because it's going to give us the important 3 Ps of healthcare that are very, very important. And what are the 3 Ps? Prevention, prevention, and prevention. The first P is prevention. If you prevent yourself from getting an illness, you will be 100% cured from that illness, and that's a problem. That's a fact. The second P is prevention protects you against severe illness. It's like buckling your seatbelt in a car. You can buckle your seatbelt in a car. It won't prevent you from getting in an accident, but it can help you not get ill from the accident itself. And the third P of prevention is that it saves you money. You don't have to pay doctor bills, hospital bills. You don't have to have time off work and things like this. You're able to continue to interact with the community as the jobs that you do. And so these 3 Ps of prevention are very, very important. And that's why this first meeting is so important, because what medical science can give us are the ability to prevent illnesses by the immunization programs that we have. And I'm very happy to lead off our presentations here with members of the Immunology Partnership. And we're going to be turning the program over to Ms. Hill Powell, who is the Chief Operating Officer of the Immunization Partnership, will introduce the program and who is going to speak today.
Thank you so much, and thank you for giving us the opportunity to talk with you all here today about immunizations, what it is, the history of it, and why it's important, and what you each can do in your community to help. So let me share my screen and hopefully so why vaccines are oh, I'm so sorry, this is not on the right one. Okay, so again, the immunization partnerships, and we're going to do a presentation for you on why vaccines, why they matter, the history of it, and the future of vaccines in Texas. Unfortunately, our community engagement director, Denisha Prim, wasn't able to make it today, but hopefully she'll be able to talk more with you guys about your needs in the community. Again, my name is Hill Powell. I'm the Chief Operating Officer here at the Immunization Partnership, and I've been here for about 5 years. And then we have Dr. Moloku, who is the Associate Professor at the Department of Family and Community Medicine. She's going to talk to you about why vaccines are so important. And then Jason Sobo, who's going to talk to you about the importance of advocacy in Texas. And so just a little bit about who we are. In 2001, we started as the Houston Harris County Immunization Registry, where we really were trying to work with hospital systems within Harris County to have a single registry for immunizations. Luckily for us, Texas decided to have MTRAC and do a whole large Texas registry. And so our mission at the time faded away. And in 2008, the board changed its focus and we were named the Immunization Partnership. So we had a new mission to do advocacy and education and step away from just doing a registry system. So who we are now, our mission is to advocate for disease prevention. And we do this by using impactful vaccine champions who promote vaccine education and evidence-based public policy on the benefits of vaccinations. And one of the things that we do is aspire to be the trusted resource for increasing immunization rates in our communities. And what we do is we provide that voice for Texans. So we connect organizations and people who do research, are industry experts, have that knowledge. We educate lawmakers, community members, other organizations to equip them to support immunizations and help advance good practices. And then we, of course, advocate for good public policy to increase those immunization rates. So how do we do this? We want to create a pro-vaccine movement across Texas. And it's not easy, but we do it through education. We have something called the Immunization University, where you can receive online training. We also train community health workers so that they can talk to their clients about the importance of immunizations, uncover the barriers that they're experiencing, and come back to us with ways that we can help solve these barriers. And then we do school nurse education, because we know that school nurses are some of the most valued members of our community. They're talking with the parents, they're in the system, and they're working with the children. And then we also do this through community engagement, through forums, surveys, focus groups, and then of course our volunteer program. And then advocacy, bill drafting, educating our lawmakers, talking in legislative hearings, and providing public testimony. I apologize that you're going to be hearing me speak so much tonight. So let me talk to you about the history of vaccines. So in 1700, this little thing called smallpox, we got a vaccine for it, and that really kicked off what we know as vaccines today. And then for about 150 years, not much happened. And then starting in the early 1900s, we were able to get vaccines for pertussis, diphtheria, and tetanus, which later is combined to be the DTP. And then we also had the flu vaccine. And then in the 1950s up through today is when you really see an escalation of vaccines. So, you know, kids were receiving 5 vaccines, and then it became 7, and now children are protected against 16 types of vaccines. So you can really see this. We go from polio all the way up to, as we all know, COVID in 2020 and 2021. And over a really short amount of time, as compared to the last slide, which was over a couple hundred years, this is really just over a few decades. So vaccines build protection. There are building blocks to the system. And so across our lifespan, we have the opportunity to receive protection through vaccination. We are protected against 18 different diseases, 7 types of cancers, and vaccines are designed to protect us from day 1 with hepatitis B, and all through our golden years with pneumonia, shingles, and of course, our yearly flu. So these are the building blocks to our immune system. They provide a defense against preventable diseases and cancers. So today's schedule, because they do build a lifetime immunity, each shot you receive teaches your system to identify the disease it's preventing and then to do this quickly. It helps build antibodies, and the more antibodies you have to a disease, the quicker it can fight it off, and you're healthy. So over several decades, scientists have made vaccines safer and more effective. So today's vaccines have less antigens, which are the virus or the bacteria in the vaccine that creates the immune response. And vaccines offer better protection against disease. So in the 1980s, children were receiving 7 vaccines for 7 diseases, covering, and they had 3,000 antigens in it. Now, we are protected, children are protected from 14 diseases with only 150 to 160 antigens. So you can really see that the science has changed to be more effective and to be safer. So we're have double the protection while having a 95% decrease in the amount of antigens that go into the vaccine. So hesitancy, vaccine hesitancy is a spectrum. I'm sure some of us have heard the term anti-vaccine or pro-vaccine, or I don't know what I think about vaccines. So in 2019, vaccine hesitancy became one of the top 10 threats to global health. It's a growing issue in more than 90 countries. Vaccine hesitancy is defined by the World Health Organization as a delay in acceptance or refusal of vaccines, despite the availability of vaccination services. And it's important to really remember that vaccine hesitancy is a spectrum. And it's real critical because people don't fit nicely in categories of anti-vaccine or pro-vaccine. We have vaccine supporters who will shout from the rooftops how much they believe vaccines prevent millions of children from dying. And then we have vaccine deniers that no matter what science we put forth, they will not be vaccinated. But there are so many people in between that. There are people who pick and choose what vaccines their children receive, whether they're on a delayed schedule. There are people who think that vaccines are valuable and can provide protection, but they have a lot of concerns. So when encountering people with questions or concerns, it's important to remember to listen, and that everybody comes with their own life experiences, their own culture, and their own history that shapes these questions and concerns. So originally this slide was called History of the Anti-Vaccine Movement, but I really want us to go back and think about that previous slide of this vaccine hesitancy spectrum, because you can really see the spectrum shift all around in the past 50 years. So in the 50s and 60s, there was a lot of social and political climate that changed or affected vaccines in the United States. In 1955, you have what we refer to as the Cutter Lab incident. Cutter Laboratories in California mistakenly put the live polio virus in vaccines. So these vaccines were sent out to rural communities, and almost 250 cases of polio were caused by these vaccines. So this incident caused distress across communities in the 1950s because the government was saying, please get vaccinated, and then people were getting vaccinated and then getting polio. So additionally, vaccine access was a challenge in the 50s and 60s. You had US government leaders not thinking that not wanting to have vaccines be free for everyone. And then you had vaccine companies charging high prices. So vaccines, and there was not a clear distribution plan for the vaccines or education, and there wasn't equitable distribution. So you had private doctors in white upper middle class communities having access to these vaccines, but communities of color not having access. And these communities were vulnerable to the disease and saw higher rates of polio and measles, leading to a high level of distrust of the government. And so also during this time period, you had 4 vaccines that rapidly were released. And as we all have just experienced with COVID, that rapid release had a lot of people questioning, is this safe? What's going on? And especially with diseases that at the time were what they called mild, because everyone was used to treating measles and the mumps. So, and that's just in the 1950s and 60s. And then you move on and you have a real more modern anti-vaccine movement beginning. You have patients' rights playing a huge role in vaccines, the transparency of the government. Then in the 80s, there were concerns of neurological outcomes from the DPT vaccine because of a documentary called DPT Vaccine Roulette. So then lawsuits started. This is when the National Vaccine Injury Compensation Program was formed. And then when you move into the 90s, 1998, Andrew Wakefield published a study of 12 children, and he said he purported to find a link between the MMR vaccine and autism. And this study, while it was later found to be fraudulent and was redacted, at that point, it was already in the hands of celebrities like Jenny McCarthy, who was getting on Oprah to say vaccines caused autism. And so it's probably a good time to note that Wakefield did lose his medical license and then moved to Austin, which is where a lot of the anti-vax movement is centered here. And in that anti-vaccine rhetoric shift, that really started in 2015. It was after the measles outbreak at Disney is when California removed their non-medical exemptions. There was a bill here to duplicate this in Texas, to remove these non-medical exemptions. And in a response, you had very vocal political action committee, Texans for Vaccine Choice, where you had prior vaccine skeptics in Texas talking about things like toxins. This group was talking about parents' rights and individual liberties. And these terms started becoming more effective in the state legislature. And of course, then these terms found fertile feeding grounds during the pandemic, when the anti-vaccine groups joined with the anti-mask groups at the beginning, and there was a new support for those who opposed COVID-19 vaccine mandates. So what are we dealing with? And then I'm going to kick it off to all the other speakers. Is as I mentioned, in 2000, there was a bill in 2003. There was a bill to allow for non-medical exemptions, meaning parents could opt their kids from having the vaccine requirements at school. So in 2003, we have about 2,000 parents doing this. Well, and then you can see that now we're up to, at one point, over 91,000 parents opting their children out from getting these school-required vaccinations, meaning these children are going into the schools and they're not required to be vaccinated, which leaves communities susceptible to outbreaks. So you have a greater risk of complications from these illnesses, and then increased risk of disability, and then, of course, an increased risk of death. So leaving on that very light subject, I want to pass this on to Dr. Moloku, who's going to talk to us about, why they are so important.
Good evening. As Ms. Hill mentioned earlier, my name is Dr. Jennifer Moloku. I am an Associate Professor of Family and Community Medicine at Texas Tech University Health Science Center in El Paso. I'm also a member of the board for the Immunization Partnership. Next. I want us to take a few minutes and look at all of these diseases on the slide right now. And I want us to think about two things. One is, which of these conditions do you personally know somebody that has gotten sick or died from it? Not what you read in the news, not what you see on Facebook, but somebody that you know personally has had one of these conditions. And if you've met somebody with one of these conditions, how many of these conditions have you ever actually seen in real life? And I'm talking even those who are in healthcare in this country, how many times have you seen any of these conditions in a live individual? I've been asked many times why I'm so passionate about vaccination. And part of the reason is that I grew up in Nigeria, and I actually started my medical education in Nigeria. And at the time when I was in medical school, some 20 plus years ago, many of these conditions were very commonplace. I remember being a medical student during my pediatric rotation, and we had to have a clinical exam. And I remember one of my patients who had a measles infection that had gone into her brain. She was a beautiful 2-year-old girl. And throughout my interview that day to present to my supervising doctor, this girl had been unconscious through the entire interview. I just remember her being so chubby and so pretty, but the main point of her history that day was that her mother had not gotten around to vaccinating her against measles. And at that time, vaccines were not as accessible as they are today. And they're probably still not as accessible in countries like Nigeria as they are in places like the United States. I remember coming back a couple of days later to check on her and being informed that this beautiful girl had passed away. Next. I wanted us to then move from what, for most of us who live in the US currently, would be obscure conditions to something that is a little more ubiquitous. It's everywhere, the flu. I know that anybody who listened to the news or had any kind of social media would have heard about how this year's flu season is a lot worse than it has been in the last several years. And this is a slide from the CDC that shows us how early our flu season peaks and how high it has risen. I know that if I ask that question I asked with my earlier slide, in this slide, asking how many people who know somebody who's personally been affected by the flu, many hands are going to go up. Next slide. What we want to think about, though, is that even though many of us know somebody who has had the flu, and many of us probably have had the flu ourselves, there's this sense that the flu is not a big deal because we feel crappy for a few days, maybe a week, and most of us do okay. But we also have to remember that over 100,000 Americans are hospitalized because of influenza every year. Next. When you think about this numbers game, you realize that the more people that get infected with the flu, that means that more people will need to be hospitalized. And unfortunately, more people are going to die from the flu. If you compare what our flu burden estimates are for this flu season compared to the flu season of 2019-2020, you can see that as these numbers increase, the number of people that will have to be hospitalized from the flu increase exponentially, and the number of people who end up dying from the flu increase as well. What we're estimating is that over 13,000 adults in the US this year, 13,000 people in the US this year are going to die from the flu. That is a horrible place to be. Next. I want us to think about general things that increase our risk from really having severe flu, because many of us will have the flu and be okay. But for children and young infants who are younger than 5, the risk of hospitalization and death increases significantly. For adults, especially those 65 and older, and pregnant women, the risk of being hospitalized and dying from influenza also goes up significantly. If you then have any associated comorbidity, next slide, that increases your risk significantly. So we want to think about heart disease, lung disease, diabetes, having any kind of condition that compromises your immune system. Something that we do not realize is that being obese actually significantly increases our risk of having severe influenza. And this is also similar with our risk for COVID hospitalization and death. And so while we may feel that we're not at risk because we don't have heart disease or lung disease or diabetes, at least 30+% of the US population is considered obese, and even a higher number are considered overweight. And so many of us have these underlying risk factors that we are not aware of. Next. Why don't people get the flu vaccine, since we know that millions of people will get the flu every year? Millions of people, or hundreds of thousands of people will be hospitalized, and thousands of people will die from the flu. This is the reason why many people give for not getting most of their vaccines. They don't think the vaccines work very well. Many people are concerned about potential side effects. Many people don't feel that they're at risk. They say they've never gotten the flu or whatever disease condition that we're trying to prevent. And therefore, they don't see the need to protect themselves against the condition. Some people are concerned about getting the diseases from the vaccines, or don't think that the flu or whatever condition that we are talking about is a serious illness. And so we're going to talk about each of these concerns one at a time. Do vaccines work? Yes. We have decades of evidence to show that vaccines work and that they work very well. If we think about the list of diseases that we talked about in the earlier slide, there's a reason that most of us on this call have never met an individual with any of those conditions. In fact, I like to tell people that vaccines are actually victims of their own success. Because vaccines have done so well to limit our interaction with some of these diseases, we don't think that they exist or that we are at serious risk for them. And therefore, we don't see the importance of getting the vaccination. But it is because of the history of robust vaccine campaigns. That is why many of us can walk around never having met somebody with measles or whooping cough or diphtheria in our lives. Vaccines are safe as well as effective. We have decades of data to show the safety of vaccines. And we continue to monitor vaccines for their effect. Many people feel that they're not at risk or they've never gotten the disease for which they're protected. That is why we need to get the vaccination. Like Dr. Gatt mentioned earlier, when he talked about the 3 Ps, prevention, you will be 100% cured from a condition that you never get or that you're able to prevent yourself from getting. You cannot get flu from the vaccine or the disease from the vaccines that you are getting. The way most vaccines are made now is that they contain a very small amount of the part of the bacteria or the virus that lets the body know what that bacteria and virus is. Most vaccines do not contain enough to make you sick or to make you get the disease. They just contain enough of that virus or bacteria to let your body know what that disease is and to help your body prepare to fight the disease. Many people do not think that either the flu or many of these diseases that we're preventing are serious enough to get it. And in many ways, it is like playing Russian roulette. While many of us will get these illnesses and be fine, many people will die from these conditions. And so it is important that we get vaccinated when we have the opportunity. Next. Next slide. Thank you. So how do we know that vaccines work? We know that vaccines work because we have data to show that people who are vaccinated are less likely to have severe illnesses, less likely to be hospitalized, and less likely to die from vaccine preventable diseases. We see this in COVID, we've seen this in flu, and we've seen this in all of the 15+ vaccine preventable diseases for which we have vaccines for. We see this because we've been able to eliminate smallpox from the world, and we were very close to eliminating polio until we had resurgence, giving to higher rates of non-polio vaccinated individuals. Next. Next slide, please. I wanted to kind of end off with talking a little bit about health disparities when it comes with infectious diseases. We know that there is a lot of health disparities in this country for a lot of conditions: heart disease, high blood pressure, diabetes, hypertension. What is sad is that we actually have huge disparities as well from infectious diseases. When we think about flu hospitalization, African Americans are 80% more likely to be hospitalized from a flu. This is 30% in Asians and Native Americans. Hispanics are 20% more likely to be hospitalized from the flu. When you look at our rates of vaccination, you will see that Black Americans and Hispanics are more likely to not have received the flu vaccine when compared to white Americans. The question is why? We know that there are many reasons why there is this disparity in vaccine coverage. There is the access issue, where we're talking about access to doctors, access to healthcare, access to places where you can get vaccine, higher rates of being uninsured or underinsured. But we also know that there is historically a mistrust for the healthcare system that is rooted in very valid concerns, but that historical mistrust has now led to a situation where we are less likely to take advantage of preventive health services that are actually in our best interest. Next. So I wanted to end my discussion by, next slide, please. I wanted to end my discussion by talking about the 1P, which is prevention. We have to remember that there's several, I call it the 4 pillars with, four legs of a stool with a 5th spoke. One of it is exercise, reducing stress in our lives, trying to get our rest, sleep, eating healthy, making sure that we're having appropriate hygiene, but importantly as well is vaccinating against those conditions that will increase, that we have preventative services to prevent us from getting those cancers and those infectious diseases that can lead to loss of life and also long-term illnesses. And next, I am going to move on to John Sabo, who's going to give us a call to action.
Good evening, everyone. Hill, I think you're operating the slide, so let's get rolling. My name is Jason Sabo. I am the lobbyist for the Immunization Partnership, and I have worked at the Texas Capitol on issues related to immunization access for about 15 years, and I've seen a lot of stuff and I've seen a lot of things change. And what I'd like to talk about tonight is kind of where we are right now with regards to vaccination policies. And I have to say, I meet a lot of people. The coolest person I've met in the last year is Dr. Maloka, who just spoke, who is one of the state's most important voices on things related to immunizations, a new member of the board of the Immunization Partnership. And I think that something she said, really kind of resonated with me right there at the end. And I think that it kind of highlights one of the very first conversations I had about the pandemic, about the coronavirus at the Texas legislature, was with a young Black woman who is the chief of staff for Harold Dutton, who's a member of the legislature from Houston, who I'm sure some of you know. Her perspective on all of this, she looked at me, kind of crossed her arms and said, "Jason, I got one word for you, and the word is Tuskegee." And I think that, Dr. Moloka really brings up an important point that I want to begin my part of the conversation with, about these historical realities that are not anomalies, that are conscious policy choices that have brought us to where we are today in the United States with regards to all of our policies and how we write and do our laws. But that includes things like vaccination policies. And I think we need to recognize that, as Dr. Moloku just said, and I wrote this down because I thought it was so well put, that Black Americans are less likely to take advantage of health services that are in our interest. Not only are those services disproportionately unavailable, but in many cases, those services there are these historical precedents, and it looks like we're having a problem with the presentation. So Hill, we're having your presentation is jacked here, Hill. If you could get it back up, thanks. So thank you. Go back to the previous slide, if you could. The other direction, thanks. So the reality, one more. Let's just start here. How about that? So when you think about Texas politics, I gotta say, I've worked on vaccinations for a long time. And during the pandemic, things dramatically changed, right? There were so many more bills that became, for whatever reason, I think, we've all kind of watched how we've talked about vaccines over the course of the last couple of years, right? And previously, I've been doing this a long time, and and immunizations and vaccines were not a real political hot topic. They were something that Democrats and Republicans could agree on, generally speaking. And the overwhelming majority of the bills that were being filed, that were being put forward, were pro-vaccine. We would go to the legislature and talk to members of the legislature about vaccines, Democrats, Republicans. People would have questions. Normally, of course, they should have questions. They did have questions, but everybody agreed on this stuff. Everybody's general belief was that, you know what, I saw what the world was like when we had polio, or I at the very least know that, I want to protect myself and I want to protect my family. We hadn't become quite consumed with the conspiracy thinking about a lot of things that we are now, right? So the vast majority of the bills that were proposed, and the overwhelming majority of almost exclusively, right, the bills that actually became law were pro-vaccine. People were like, yeah, good stuff. Not dying of preventable disease is a good thing. I mean, I think that's kind of not a real controversial position. Next slide, please. But the reality is, things began to change. And I think that the pandemic brought forward change that none of us could have anticipated or none of us could have expected. And the reality is that during the pandemic, vaccines that had often been considered to be in many ways kind of par for the course, right? That's what we do. All of a sudden, not only became questioned, but became extremely political and extremely very much about the politics of the issue and how we all would or would not get vaccinated. It became a political thing. And the reality is, as it became a political thing at the Texas Capitol, we began to see a lot of really, really bad bills being filed. And last session, was a very kind of a weird session, because remember, the Texas legislature is meeting right now, right? For like a 5-month period. They're in Austin. They're talking about all the stuff that guides our lives, including the vaccine policy stuff, but everything about our lives, right? But we saw last session, as opposed to this positive kind of, okay, vaccines generally speaking a good thing, all of a sudden vaccines became bad, right? So for the first time, it was almost like people weren't so much opposed to the vaccines. In many ways, they were opposed to government telling them what to do, right? There's no more of this thinking about, I have a responsibility to protect my grandma from getting sick or someone else's grandma from getting sick. It became this thing about, I got mine, I want to keep mine, and who cares about everybody else? And it's kind of the opposite of community, right? And if you think about vaccines, what makes vaccines so effective is this idea of community immunity, right? Everybody gets vaccinated because we are all in it together, right? It's why it's called public health, not private health, right? It's this idea that people are going to get together and do it. So last session, we had this kind of conversation switch, and all of a sudden the vaccine stuff became something that was very political. And this session, now the legislature is back, and I've been doing this for a really long time, right? There have been more bad vaccine bills filed in the last 2 weeks than there have in the 20 years almost that I've been talking to people about this stuff. For whatever reason, we have uncorked this genie that people don't like vaccines anymore. It's a little bit wild, right? And I think part of it is, as Dr. Maloka was just saying, these vaccines are the victim of their own success. People don't see polio anymore. They don't see measles anymore. They don't see these preventable diseases anymore. Why? Because they've been prevented. That's the whole point. And that is, I think, really becoming problematic as you think about this from a political perspective. We're now confronted not with people who have a real world understanding of how bad and scary this stuff is. We're presented with people who actually believe what they read on Facebook. And I know a lot of you are watching this on Facebook Live. Question everything you're reading about the vaccines, because, oh man, that social media stuff is real and it's distorting people's perspectives. Look at the frames around you. Probably each of you have little screens over here or something, right? Or these ads that are coming at you all the time, right? It's really changing how people are approaching these issues, and it's changing the laws that are being approved. by people in the legislature in Texas and other places as well. Next slide, please. All of this to say, I mean, I'm going to be Mr. Gloom and Doom, right? Because, let's go to the next slide, please, if we could. I've been Mr. kind of gloom and doom about all this stuff, but the reality is there's good stuff that has happened around vaccines because people understand the personal level, on a very personal level, right? How important these vaccines are. But I got to tell you, when I started doing this kind of work at the Capitol, I'd go to these hearings where these people were having these debates about these bills related to vaccines, right? And there would literally be a guy who would come. This is not a joke. I swear to you. There was a dude who would come to these hearings and he had a hat that was made out of tinfoil. And he would come and he would testify to the committee wearing his hat made out of tinfoil, which, as a lobbyist, that makes your job easier. You kind of want the guy to be there to talk about, you kind of want the guy to be there in the tinfoil hat. Because that makes your job easier, right? You look like, no matter what you say, you look really reasonable and rational because at least you're not the guy in the tinfoil hat. Now, that kind of whole anti-vaccine thing has kind of shifted in the last couple of years. And what we see now are it went from being the guy in the tinfoil hat to people who look like your neighbors, like the people in this picture right here. Provided they look like your neighbors if you live in a white suburb around, a large metropolitan area. Suburban white people hate vaccines. I don't know what happened. I don't understand it. And the reality is the same folks that have the heartburn about this stuff are beginning to show up and they vote in Republican primaries and they come to the legislature. And, the way that the reality of our politics work in this state now, there were 150 House races in November. Of the 150 House races, basically one was competitive in November. November doesn't matter anymore. The only thing that matters is the primary. And if you're running in a Republican primary and in one of these very conservative districts that were intentionally drawn by the people who draw the maps, right, of the Capitol, when they gerrymander stuff, they drew them to be super conservative. And if you make the people in this picture mad, you're not going to get reelected through the primary, which means you're not going to get reelected because the primary is now the de facto general election. So these folks who hate vaccines have a disproportionate political power because of the way we choose to write and draw the maps. And all the other stuff that the legislature does, and you kind of scratch your head and you're like, well, that's really weird. Why do they do that? It's because they're beholden to very comparable interests to those you see in this picture right here on a whole host of other issues that ultimately define how the rest of us live our lives, right? Which is a little bit disconcerting. Okay, next slide, please. But all of this to say that the legislature, is coming back right now and they're meeting and they're talking about a lot of stuff. And a lot of things that we all care about around public health, next slide, please, are very much on the table. And I urge people to kind of pay attention to what's going on. And I really want to close today my comments with, last session, there was a guy, and we'll eventually get to the slide with his picture on it. There was a guy named Boris Miles. One more, please. And I hate to leave over this one, but one more, please. We're running out of time, and I apologize. There's a guy named Boris Miles, who's a Texas state senator from Houston. And in the Senate Health and Human Services Committee hearings, there was a lot of conversation. That's a picture of him right here. There's a lot of conversation last session about whether or not we were going to do an equitable job distributing the COVID vaccine. So what Senator Miles did from Houston, and a guy named Bobby Guerra, who's the hair challenge gentleman in the middle there, he's a state rep from so Senator Miles, Representative Guerra, a Latino from the Valley, McAllen, got together, and they were both concerned about whether or not underrepresented communities that, as Dr. Maloka was at were less likely to take advantage of health services that are in their own interest for historical reasons, access reasons, which are arguably historical as well, with all the institutionalized racism that exists within our healthcare system. They said no. They said, no, that's not the way we're going to do it. We're going to pass a law that requires the state to make sure that we have data about how, where, and when those vaccines are distributed, right? That's a big deal. That bill passed last session and is now law. There are people who are fighting for the stuff we're talking about tonight in the Capitol. And the Immunization Partnership, which is, just Google Immunization Partnership Texas or immunizeusa.org, is paying attention to what's happening in your state capital. You need to be paying attention to what's happening in your state capital too, because the stuff that's happening is not necessarily happening in the interest of people who, as Dr. Moloku said, are less likely to take advantage of health services that are in their own interest, which is all of us, but particularly those for whom healthcare access has been denied. And with that, I'm sorry I've gone over by 2 minutes, and I will shut up.
Thank you so much, Jason. So now we're going to open it up to questions and from the attendees. Dr. Gath, if you had anything, you can go ahead and speak as well.
I'll lead off with a question for Jennifer. Can you comment on the mRNA vaccines? There's been a lot of concern about this as genetic material. There's a lot of concerns that the research went too quickly. Can you comment on where we are scientifically about why the research went so quickly and the safety of the mRNA vaccines? Because I think this platform may be used in future vaccines. We need to get the information out about their safety and how the science went through.
Okay, so there are a few things that I want to point out. First of all, Ms. Hill was talking about the history of vaccine development. You could see that we started with one vaccine. It was 100 years or more before the next one. And the speed with which vaccines were being developed progressively increased. That's what happens with progress. I mean, when I was in college, we didn't have cell phones. Now my 12-year-old has a smartphone with everything at the top. That's what science does. And with the mRNA technology, what it's important for people to understand is the M in mRNA stands for messenger. And what that means is that this is the protein that tells the body how to produce certain hormones. It doesn't become part of your genetic makeup. It actually is set to destroy or to kind of break down after it has done its work, which is a messenger, deliver the information that it needs to. And that's the only work that it is. It is because over the years, science had evolved to the point that we had the mRNA technology. That was why we were able to take technology that we already had and then putting vaccine development to it and more quickly and effectively develop a vaccine to help us save lives.
Great, perfect. Thank you so much. And I had a question for Jason. Texas is the most underinsured state as far as healthcare is concerned in the entire United States. The vaccinations that we're talking about, are they available to people uninsured in most of the communities here in Texas? And what is the legislature looking at doing about that to make sure that information gets out?
Well, the reality is, if you're under 18, the answer to the question is yes. You do have access through the federally funded Vaccine for Children's program. If you are an adult in certain limited circumstances for certain vaccines for certain people, you have access to the Adult Safety Net program. And Texas, to its credit, I think it's important to say that is one of a handful of states that actually does fund an Adult Safety Net program. But the reality is the reality, which is that, and I think that, Doctor, you noted this at the very beginning, that I think the word that you used was navigate. And I think that that's an important word. And in Texas, we've refined our healthcare systems in many ways to essentially a system that I refer to as rationing by hassling. We make it difficult for people to navigate such that they're unable to access the services. And this idea of equal healthcare excellence and access, which I think you also said at the outset of our conversation, we don't have that. And the reality is, not only do we not have that for the very for the for necessary healthcare services. We don't have that for basic healthcare services, and that includes for access to things like vaccines. And I think that there are structural problems there, which highlights the importance of legislation like that proposed last session and passed by Senator Miles and Representative Guerra that begins to address those issues from the ground up and begins to get the data so that we can, go to the legislature and say, the proof is in the pudding, the numbers are clear, there is disproportionate access, and disproportionate access results in disproportionate death, suffering, completely unnecessarily, because these are preventable diseases.
Perfect. Any other questions from our panelists? Did anything come through the question and answer?
Yes, we do. We have one from Claude Cummings.
Okay.
Claude, can you hear?
Hi, thank you. Well, first of all, just to comment, thank you so much for this information. It's really been great tonight. I'm the first vice president of the NAACP Houston. It's been absolutely fantastic. There's so many people of color that are just afraid, and I might have missed this because I was in another meeting in the earlier part, and you might have answered this. What can we do to just encourage them to take the vaccine? Because there's still so many questions about it when I'm in forums of and other places and talking to them about the need to take the vaccine.
Why don't we leave that, Jennifer? What do you do for the vaccination hesitancy people? How do you address them? We see those, we see those every day in our clinics. We have those conversations.
Right.
Tell me what you're doing, because I'm interested in knowing.
So, first of all, I think we start by listening and having conversations. People have real fears and real concerns about accessing issues. Like we said, there has been historically things that have happened where you can't deny it. This has happened historically. And so listening and validating the fact that their fears are not completely unfounded, but then providing educations for the specific concerns that they have for that specific time. It I found that works best. And it's one person at a time. I had a young Black girl who's a patient of mine who, I had not been able to convince her mother to get the flu vaccine, but I finally convinced her because she had asthma. And then she came to me for a pap smear, and her pap was abnormal and it was positive for HPV. And I said, you're young, how about we start the vaccine, because she never got the HPV vaccine, and we'll do your pap again in the 1 year. She came to me recently, we repeated her pap was clear and the HPV was cleared, which could have happened, but because of the fear and the concern, she went ahead and had her vaccine. That is one brand new vaccine champion that I have in my clinic. Because after I called her to let her know that her HPV had cleared and her pap that was abnormal was now clear, she was like, I'm gonna tell everybody I know, they better go out and get this thing. This vaccine really works. And I wasn't sick, I didn't have side effects. And so we're gonna change the hearts and minds of our community, one person at a time.
Okay, thank you so much for that. And it's great information on tonight.
Thank you so much, Claude. And I think the hour's upon us. We finished on time. We had a lot of great information. I am most appreciative for the Immunization Partnership to be part of our inaugural town hall meetings. The information, the entire program will be available at the NAACP website. We want people to take this information and to spread it around. We know there were several people on this presentation or this particular platform. We want this information to be sent around. Send it and share it to everyone that you know. This will be the first of many. Thank you all so much for your attendance and your time this evening. Be safe, get vaccinated. Thank you so much.